Hello, I'm Patty Dixon, and today we're here working with Skin, Body, and Soul to demonstrate the microneedling procedures that they're getting ready to start offering. Not only can you use it for skin and scar amelioration on the face, you can work on the backs of the hands to tighten up the skin. You can work around the knees to tighten the skin for those of us who are aging and starting to get wrinkles a little bit around our knees. It can work on cellulite. It can work on stretch mark, the neck, tightening this area here, the décolletage area, getting rid of sun damage, and the basic principles on the microneedling is that you have these 9 little needles inside the replaceable cartridge. The needles are driven by the motor of the pen to go in and out of the skin, creating small microchannels which will start a healing cascade naturally. You can enhance that by using some stem cytokines and some vitamin C serums while the skin channels are open for about the next 15 or 20 minutes after you do a treatment. The serums and the stem cytokines will go into the skin and start the rejuvenation and the healing process. Today we're treating stretch marks, and the first thing that we'll do is cleanse the area, which we've already done, and we will start at, for Skin, Body, and Soul, a 0.2 millimeter depth. The first thing that we want to do is show the client what that's going to feel like so that when we go to the area that we're treating, they're not going to be surprised. Are you okay with that? Mm-hmm. And then we just take the cues from the client or the patient as to how many passes we can go and how deep. We're going to start with the 2.2 millimeter because she's comfortable with that.
You okay? Yes.
You okay? We make our first passes to open up the skin so that it can receive the serums and treatment components that we're going to use in conjunction with the microneedling therapy. And when you're working with stretch marks, you'll want to pull the skin tight so that you get good penetration of the needle. That tissue is relatively soft and it's easy to pass by without getting good penetration of the needle.
I'm trying to get it all.
Oh, good.
Are you comfortable? We can go deeper with the needle?
Yeah, you can go deeper.
Okay. So now that we've opened up the skin, we will apply some stem cell cytokine serums that are specifically designed to work with the microneedling system.
Are you doing all of the skin in that area or just the stretch mark?
Mm-hmm. You can do all of the skin in that area.
Probably get better results like that.
Mm-hmm. And on the second pass, we go in the opposite direction that we went. Then we went in the first pass so that we get a nice 100% coverage of the area. Be sure you get that one.
What?
There's
Just
a
one
little
little
short.
Oh,
one.
yeah.
It's a little short one hiding
Yeah.
there. And what depth are we at right now?
0.3.
We're on 0.3. And what speed are we? Are we 3? Okay. Can start out on a level 3 speed, and if the client tolerates it, then you can continue with that level. If the patient is a little uncomfortable with it, you can back it down to a lower speed and see if that's better for the patient.
Oh, sorry.
And what's your needle depth?
0.3.
Your 0.3? Do you feel like you can go to 0.5?
Yep.
Okay. On your next
Do it.
pass.
Say cap on.
Feels real good.
It feels like a massage.
This is amazing. Did you really have to say that?
Hey.
For the rest of your life, probably.
Yeah.
Where's their test?
Get an A+ for humor.
Yes. Most definitely. For keeping my little ego in check. Okay, before you turn it off, as an extra, because stretch marks on the thighs are a little more difficult than those on the belly, go ahead and follow each stretch mark with a pass down each individual
While I
stretch
have it
mark.
on 0.3.
Yes, or you can bump it up to 0.5.
Raise it.
Go ahead and raise it, turn it off. Change the depth. Now, it will pick back up exactly where you left off as far as the speed. So you may have to bump it back up to speed 3. There you go. You okay?
Okay.
And see, when you do that, see, it's red, it gets redder, so you've got some good penetration there.
That's what.
Yeah.
Should I see a result from this one?
It probably will take 3 to 4 treatments to see a result. You will see about a 25% or a 20% improvement with the first treatment.
Okay.
With the second treatment, a little bit better, and with the third treatment, even better. This is one treatment that is sort of synergistic the more that you stack one
Yeah.
upon the other.
What about hair? Does it need to be freshly shaved, or does it matter?
Yes, you would want to, it doesn't need to be fresh.
Like for a man, for their face.
Just from the morning, shave just from the morning is fine.
Yeah, you have to hear it.
And does the pattern matter? 'Cause, you know, like when you're doing like other things with the face, you have to like be careful with
You
what.
mean the hair for
For the hair growth.
the corner.
Yeah. Well, no, not for the growth, but like when you're doing like anything else with men, like on their face and stuff.
Like there's a different direction that
You
you have
do
to
want
do
to
your
go,
motion.
yes, you do want to go with men and they've got facial hair. You do want to go in the direction of the growth of the hair.
Okay.
You can press even a little harder. There you go. Yeah, get that one. Go another time on that. Get it good. Get it again.
Get it
See how
again.
when it gets pink, you know
Yeah.
you've gotten.
Are these
a good-
running or babies?
Huh?
Are they running or baby? Stretch marks.
What does running mean?
Stretch marks
are
from
they just
running.
from running, working out, and some babies.
I don't think this, I mean, I didn't know you got to start from working out, do you?
Well, you gain and lose rapidly.
Oh. I've never
Yeah, they're
even
one of
lost
the distinct-
rapidly. I just got it on my inner thighs like in high school.
Yeah.
Like this size, like not bad, but then on this side, they're like underneath. So they're hard to like see, but they're like underneath. I've always had them in that
You
same area.
can, she can make as
What?
many passes as you
I've
can
always had
tolerate.
them in that
Okay.
same area.
Yeah.
I've never really like gained or lost.
Right.
They're very faint like yours.
You okay?
Mm-hmm.
Okay.
Should have done a picture of them before with these.
I'm sorry?
You should have done a before picture with these.
Yeah. Stretch marks are hard. They don't always show up. You have to capture the light just right for them to show.
Unless they're really,
Some people's are like brown.
Oh, okay. I've always seen this silvery.
Yeah.
yeah, that's it. Mine wasn't right. They're like silver.
So for
You
the
can only
third
see
pass
it
on
on
this
the
one,
right.
instead of the circles, you wanna follow the
I
line?
would.
Okay.
Oh, okay, so you don't do the circle?
You don't need to do the circles because you're not needing to even out anything. You're just trying
Oh,
to
got it.
reconnect that tissue. It's like a string that's frayed in the middle, strong on the ends and frayed in the center, and what you're trying to do is sort of re-knit that. And you can never get it 100%.
Yeah.
You can get it really
Yeah.
minimal. Get this one, and then we may want to get a close-up of what it looks like after we've treated this. So if you'll just let him get a close-up of this skin section.
Put a little more rollerball on it.
Yeah,
Maybe the.
yeah, I'd put a roller ball and let her continue to work just a couple more passes, and then.
Good job.
This is different than everybody sitting in the hot tub. This is a whole nother level of bonding.
Yeah, comfort and.
More team building.
Yeah.
See
What
how
else
that's
do you have?
starting to,
Yeah.
that's what you sort of want to look for.
Okay.
So you can, use a little more pressure inward.
Don't worry, it's some kids, don't worry, but I understand.
Did you have all of them?
Huh?
You had all of them?
I did personally have a moment. I had help.
Yeah, see that one, you're gonna get a really good result on that one.
I can clean 5. My wife has 2 in there.
5 of them, he was there from beginning to end.
Are y'all married?
No.
Oh.
Is that starting to,
Feel uncomfortable? I mean, it's starting to get a little, it's kind of raw feeling.
Yeah. You think so?
You can tell.
Yeah.
A
gonna
little
get that
sore.
one and that one.
Mm-hmm.
And that raw feel.
It's almost like a tattoo.
It is, it's the same technique, same technology.
Oh,
It's the
really?
same.
Oh,
Yeah.
yeah. Okay.
Mhm.
Got the ink.
Yeah.
There's some ink in there, there's some orange.
There you go, that's really good, yeah. And we might let him have a close-up of what it looks like when they're finished with a treatment on stretch marks. And this is what it should look like when you've completed a treatment on stretch marks after the first treatment. Ta-da!